Hello, my name is Katie Fantabil. Today I will be presenting for my journal club about randomized double-blind trial of oral methyl naltrexone for treatment of opioid-induced constipation in a patient with chronic non-cancer pain. So this article does have an impact factor about 95.98. When I give a brief background information regarding this disease condition and medication, normally opioid analgesics are often administered to treat patients with moderate to severe non-cancer pain, for example, osteoarthritis. However, opioids bind to delta, gamma, and mu receptors in the gastrointestinal tract, and that may impact GI function. For example, the activation of mu receptors slow GI motility and inhibit forward peristalsis. When this happens, it leads to constipation. Evidence supports that the use of methyl naltrexone, or with the other name Relistor, improves opioid-induced constipation in a patient with chronic non-cancer pain without affecting the mu opioid receptor associated with analgesia. So this study shows the efficacy of this medication to use for opioid-induced constipation. All right, uh, the objective is to compare the efficacy and the safety of methyl naltrexone treatment for opioid-induced constipation in adults greater than or equal to 18 years of age with a history of opioid-induced constipation. Those patients have opioid-induced constipation for more than 30 days. This research sourced the Center for Clinical Research, Wisconsin, North Carolina School of Medicine, and the specific pharmaceutical company, Salix Pharmaceuticals, in Raleigh, North Carolina, USA. So this study, it included about 117 sites across USA. Enrollment date for this research study from September 2010 until November 2011. Follow-up, 14 days follow-up period was conducted. The study design for this study, for this research, is phase 3 randomized placebo-controlled double-blind trials. For this study, there were about 804 patients or people enrolled. Those received greater than or more than one dose of the study medication every day. Their number were 803. 83.1% to 90% continued treatment for 4 weeks until PRN period, and about 3 to 4% lost for follow-up. There were some inclusion criteria. The inclusion criteria for this study, those greater than 18 years of age with the history of opioid-induced constipation for more than 30 days, and those who have chronic non-cancerous malignant pain, and oral methyl naltrexone 150 milligram, 300 milligram, 400 milligram dose of the medication was given. Exclusion criteria for this study: patient with a history of mechanical bowel obstruction like megacolon, clinically significant bowel disorders, those patients who have rectal bleeding, those patients who plan to have surgery during the study period, and during the study period, during the screening period, actually, use of prokinetic agent and use of stool softeners or laxatives were excluded in the study criteria. For this study, intention to treat analysis, all patients who received more than one dose of the study during the study were included in intention to treat population. 20% of dosing per day would result in effectiveness for 4 weeks of, and power of it have a power of 90%, and also two-tailed alpha level 0.017. It was estimated around 700 patients would be necessary to detect minimum treatment difference between any naltrexone dose given. For the baseline characteristics, you can look at table 1 is listed in there. Adverse events for this study is also included on table 3, safety analysis. Dropout during this study, 3 to 4% of the patients lost for follow-up. In conclusion, an oral formulation of methyl naltrexone was effective, efficacious, and well tolerated for treatment of opioid-induced constipation in patients with chronic non-cancerous pain, particularly 400 milligram dose. The response was durable over 12 weeks period, including when the administered for 8 weeks, administered for 12 weeks, and 8 weeks of PRN dose. All right, I'm ready to take your question. Thank you for listening.